Welcome to Holistic Wisdom Live. My name is Elena, and today we're continuing a conversation on dangers and long-term implications of breast augmentation, breast implants, and the importance of taking care of your health and having a bigger, broader conversation for those of you that have had the implants, with women around you starting to look into what are some of your options. Today's guest is Daniela, and Daniela is somebody who actually reached out. She took one of the videos that I posted and recreated it with her own story. And I just reached out and I said, Daniela, would you like to share your story on my platform? I think this is such an important topic, especially as we're moving into 2023 for women. And it's really linked to claiming our sovereignty as females and not allowing the external world to dictate to us and define what beauty is. And unfortunately, in many cultures, as you'll discover in today's conversations, unfortunately, are gearing women to think a certain way of what beauty is and how beauty is defined. But before we dive deep into it, I wanted to give you guys some of the statistics, which if you go back to the first episode that I released with Christine, who is my patient and client, we shared her story. And then Uhuru's episode is coming up, Dr. Uhuru Smith, who also had breast cancer, and her episode will be coming out in the next couple of days. So let me just read some of the statistics. In the year 2018, 1.8 million, over 1.8 million breast augmentations were performed worldwide. Okay, United States is leading globally that, and the next on the list will be South America, South and Central America. And Daniela is actually originally from Venezuela. I'm so excited to reach that demographic of women. I do want to say that in 2019, we're not going to be talking about this particular brand of implants, but 2019, Allergan, which is pretty commonly used in the United States, has recalled their biocell textured implants worldwide, okay, following growing evidence of the risk of the breast implant associated anaplastic large cell lymphoma. And actually there is research now, over 100,000 women with both saline and what were the other ones? The saline and the textured, right? The textured, yeah, implants, silicone implants. University of Texas has done the research, and they came to a conclusion that it does increase your risk of breast cancer, different types of cancers, including melanoma, and of course the cancer of immune system, and therefore lots of autoimmune disorders. I just want to read the list of different type of side effects, right? And they can come with many years after you've had an implant. So here are some of the systemic side effects that have been reported of women experiencing over the years, and they are anxiety, chest pain, chronic fatigue, cognitive impairment, brain fog, memory loss, depression, discoloration of hands and feet, dry skin and or hair loss, headaches, hormonal issues, inflammation, joint pain, migraines, muscle pain or myalgia, numbness or tingling in the upper lower limbs, rash, recurring infections, sensitivity to light, shortness of breath, sleep disturbances, and vertigo. Also rheumatoid kind of symptoms, right? Rheumatoid arthritis, scleroderma, and I did say melanoma is another one. And actually the risk of melanoma increases by between 2 and 8-fold in women who have either type of breast implant. So Danielle, thank you so much for being here today and sharing your story. And by the way, you live in Florida as well. So we're both in Florida. You're in Fort Lauderdale, and you immigrated to the United States from Venezuela. So let's talk about your journey of what made you want to get the implants, and perhaps draw a picture of the culture that you were raised in.
Yeah, thank you, Elena, for this opportunity.
Yes.
Yeah, in Venezuela is very typical. I mean, it's like it's so normal to have implants from a very young age. We live in the country that, have won, I don't know how many crowns of the Miss Universe, and it's so normal. Every miss has, you know, has had something done, you know. So having breast implant, it's very, very common. Everybody does it. And when you're surrounded by that, and I was so flat, and I was like, okay, I want to have my implants or whatever. I wasn't thinking about, you know, 10 years from now, I have to get another operation and what are the implications. You don't think about that stuff. It's not in your mind. You just want to be, you know, look pretty.
And did the
And
doctor tell you, like, if you want to go in, like for you, you went for a consultation, do they tell you everything is fine, or do they actually talk to you about potential risks?
no, they make you play with the implants and tell you that that's very safe. It's, you know, it doesn't do anything wrong in your body. It's very common. So it's like normal. Nobody, no doctor is gonna tell you, or in my experience, told me what the consequence might be, you know, or the, you know, warnings or whatever of the implants. None of that.
Yes, and just recently, by the way, for those of you that are watching, FDA, which is Food and Drug Administration, issued a black box warning women of the potential risk of long-term implications, such as the different autoimmune disorders or the link to autoimmune disorders and cancers for those that have had breast implants.
Yeah, and I think part of that it's because, you know, a lot of women are coming out and say, you know, I had this autoimmune illness and I have these symptoms, and no doctor has, you know, given me any answer. But when I took my implants out, it's like everything's gone.
All the
So
symptoms go away. Yeah. So let's go right.
yeah,
Yeah. So let's talk about your journey. So how old were you when you got the implants?
I got him when I was 30. I went to the best doctor and I told him, you know, put me the best implants that you have. At the time, they were, you know, the French ones. And he told me these are the ones that my daughters had. And they're very, you know, they're the best of the best. And I put them, and a week later, it's called PIP. They did a recall from all the, because I don't know, they put some silicone that it was like, you know, I don't know, some whatever.
Not safe. So it was recalled. And
Yeah.
did your doctor contact you to let you know it was recalled?
No, I contact him and I say like, okay, what are we gonna do? Took me out, put me another ones. And he was like, no, well, if I do that, I'm gonna have to charge you again, and you're gonna be safe, you're gonna be fine. This just, you know, you call me if anything. And I was like, okay, I'm not gonna pay again. So I wasn't expecting that. It was, I just got the operation. So you know, I waited. I
And
took
you
them.
decided to keep them, even though they were recalled. Okay. And how long did you keep them?
Well, 12-year pass. I've been here for since 7 years. So I moved to the US, and, you know, before I came to the United States, I did my first mammogram. I have a bad experience when I did the mammogram because the implant flipped. And I
Because
was,
they pushed your breast so hard that it caused for the implant to flip inside.
that was horrifying, because I thought, my first thought was, you know, I have a rupture. And being recalled, I was like, okay, I need to do something. I was freaking out. And my doctor is like, when come tomorrow and I'll see you.
So this is the doctor now in United States or Venezuela?
Venezuela. That was just
Venezuela. Okay.
the United States. Yeah. But that night, you know, I moved it around, and somehow the implant flipped again, and it was like normal. But since then, I was like, you know, panicking every time that, you know, in the United States, it's very important that you do the mammogram. They ask you to do a mammogram every year, and I was afraid, and I you know, I have to you know, get into fights with with the nurses, and I say, I'm not doing a mammogram because I'm afraid that the implant is going to rupture. You can do like an echo sonogram, and but that's it. And so I was in, you know, fear state. So 5 years from that, being here in the United States, I started to feel a pain in my chest. And I felt like from that episode, I thought that the pocket that the implant were in was like broken and my implant was moving. That's the sensation that I had. So I started thinking about, I have to change it. I never, it never occurred to me that you can take it out. That you just, I always been told that you have to, take it out and put another one, because you're never gonna get, normal again if you took it out. So when I started research for a doctor to do my change of implant, I came across of the breast implant illness. And when I read the symptoms, I was like, I haven't, my hair was falling out. My skin was very, very dry. I have acne. It's a sign of something happening. My body was like, trying to
Your
get
body
out.
was chronically inflamed because it was trying to fight the foreign substance in your body. Yes.
Exactly. I have the brain fog. I couldn't concentrate in anything, and I couldn't understand sometimes some things. And I was that's a weird sensation. The shortness of breath, like I couldn't breathe. So when I read all the stuff and I saw the stories of other women, I said like, okay, that's it. I'm gonna take it out. And that's what I did. I went to a very, very, very nice doctor here in Florida that does the special, operation that they remove the capsule, which is very, very important that they do that, because there's a lot of, things that get stuck on there. And so many doctors doesn't do that. They just leave the
Capsule inside. Yeah, and I was reading actually from all the literature and the studies, they're showing that actually cancerous cells are found in the capsule, and capsule is what is formed by the body to protect the body from the implant. And also they're finding a lot of heavy metal toxicity also in the capsule itself. So you found a doctor that was able to do this surgery. How long was your surgery?
It was very fast. This doctor, I mean, he's amazing. He only do explants. He doesn't put implants on women because he's seen a lot of, what happening. So he decided to never put an implant on a woman. So he only does the explant. He told me that, it's a very delicate operation. It is, I'm not gonna lie, because they have to, detach the capsule from your body. So it's a very delicate operation. It was very fast. The team was amazing. I mean, it's the best operation that I have ever had, and I've had a lot, not cosmetic, but it was amazing. And they took the implants. My capsule wasn't so calcified. It was very thin. It was very gluey. But the implants, thank God, they were great. They were good.
They didn't rupture, so you didn't have a rupture.
I didn't have a rupture. But it was like, it was attached to my ribs. So that's why they moved and attached to my ribs. So that's what the pain that I was feeling, I was like, I had to sleep with my bra because I had the feeling that it was moving to the side. It was,
and the rib was pulling it.
Yeah, it was horrible. Yeah.
How long after your explants that your brain fog went away and your symptoms started to improve and your hair started to grow back?
Well, my hair, I had like a year because I did it in 2021. And right now I'm seeing like my hair is, going crazy. It's like, it's so fast that in so much hair that is growing. There right now is the time that I'm seeing, my body like detoxified, and my hair is growing. The brain fog was like, like between 3 and 6 months that I noticed the difference. The shortness of breath was instant. It depends. Everybody is different, and it depends on the journey that you have.
Right. Every person also has different capacity of how their system is able to detoxify, right, and clear things out. And I've known some people who said they instantly got their energy, and then there are those that take a lot longer. And it also depends on your toxicity levels. Did you ever go to the doctor to get your blood drawn to see, for example, if you had mineral depletion, if you had heavy metals? Did you ever get urine tests, or do you never?
I never had, but I do a lot of detoxifying. My skin, it's like, it tells me, but my body speak to me. And when I see my skin, that it's, I've never had the type of skin that I have now. It's like, the moist is back. And so everybody says that I look younger that I am. And so for me, that's enough. But
Yeah.
every blood work that I do, it's perfect. So that was, perfect for me. And the clinic send the capsule to pathology to see, if there anything, that you have to take care of, or,
And
worry
how
about.
was that? The
Yeah,
results of
no, that
there.
was perfect. Yeah, that was great.
Okay. So thank God.
Yeah.
And you had a wonderful support team as well. You said that your husband was there for you every step of the way, taking
Yeah.
care of you when you went through surgery.
Yeah, I know that there's a lot of women, because I have friends, that their
Mhm.
husband is like, I don't want you to take out the implants. I didn't, given any choice to my husband because it's my body. And of course, he was very supportive of me, and he was with me all this, with taking care of me after the explant. And it was great. But I think I'm not going to judge anybody that, want to have any kind of cosmetic surgery. But I do think it's very, very important that women, start research. And, it's not, there's a lot that doctor is not going to tell you, because it's a very big industry. So you have to do the research, you have to learn. And I think I put my implants because I didn't really love myself or my body. And right now, when I took the implants, when I can go to the beach and lay down, face down, and I don't have to do like a hole for my implants, because it's like, oh my God, the sensations. It's like the sensation is like I'm back in my body, and I love that. I love my body. I love that I can wear the clothes that it corresponds with my personality. Because when I had the implant, that wasn't really my personality to show off or whatever. So it's been a process also to love myself, to love my body, to be comfortable with me. And like you said, not to hear the standards that the society puts on women of beauty, right?
Yes. Thank you for that. And what would you say is your biggest message to women who are thinking of going through this process? What would you say is your big message to them?
Well, do the research. First of all, do the research of breast implant illness and the consequence, and think, forward in 10, 12 years, when you have to, everything can happen. For a lot of women, the symptoms appear like 3 months after they put the implants. For another like me, maybe it's mild symptoms after 12 years, but it could be any case, So do the research, do really what's going on with the implants, and, try to work a lot on loving your body also, feel, don't hear like everybody's what's saying about beauty, and, try to connect with your body. Those two things, very important to do, I think.
Beautiful. Thank you for sharing that. I did actually read also another interesting statistics, which has to do with women who are breastfeeding with implants. And there is a significant amount of information now coming in, because if you think about it, when a woman is pregnant, we're detoxifying all the toxins into the unborn baby. But breastfeeding is a big deal, and they're finding actually newborns are born underweight. So, and there's really no long-term studies now looking at what happens to the health of a newborn and as they grow up with mothers who have been breastfeeding with implants. So this is also interesting to see, with the amount of plastic surgeries that have been put out on over the last 20 plus years, to see what kind of health implications and how it impacts the children moving forward, besides, of course, what happens to the woman's body.
Yeah. And another thing that I want to add also, that I think is very important, that if you're thinking to, do the explant, like look for a doctor that, only do the explant. Why? I had a friend that wanted to take them out, and she was like done with the implants, and went to a doctor that only do implants. And the doctor, in the operation took the implants, and he thought like, oh, no, I'm not going to leave you with doubt. and that the implants, they don't look great, and he put another implant, and she wakes with another implant.
Oh,
And
that's
now
horrible.
she has scars, she has like, it was so deformity, he was a mess. So yeah, if you're gonna do it, look for a doctor that knows how to do the capsulotomy, that is the operation where they remove the capsule and only do explants. I think that is very important also.
Great advice. Thank you so much for sharing your story.
Thank you for the space of, for me to share. I think it's important. Thank you.
Thank you.